I bet you've heard numerous times already whether or not Uber driver is considered independent contractor or an employee. Why is this a big deal? Well, it's a big deal because by law, some large companies are required to provide health insurance benefits to their full-time eligible employees, among other things, which I will not go into the details for the purpose of this video. Quite frankly, many app-based drivers have or had other full-time job, possibly with benefits already, and they were just taking gigs here and there for extra cash. However, many drivers were driving for Uber and other app-based network full-time, this being their only source of income. So, in November, Proposition 22 has passed. Voters in California voted to require California app-based network companies to provide health care stipends to qualifying app-based drivers. I will get into details in a moment, but before that I want to mention this again. If you are driving for Uber, Lyft, DoorDash, Grubhub, Instacart, Postmates, Roadie, Taskabit, Uber Eats, Wings, Shipt, Amazon Flex, Cargomatic, or Hopskin Drive, and you average at least 24 hours per week during a quarter, you are eligible to receive as much as $409 per month that could be applied towards your health insurance premium. If you work fewer hours, you may get a lower stipend, and if you work less than 15 hours per week, you may not get any stipend at all. Now, this is not going to be company-sponsored health insurance benefit, but rather a stipend that you can use to buy your own individual health insurance. Hey, I think that's awesome. Since health insurance costs are quite expensive and cost the big bucks, and many did avoid buying it in the first place for this reason. Now, since this is a big news that just happened, Covered California will allow new or existing drivers to use a special enrollment period starting with February 1st, 2021 and apply for health insurance. Okay, so we are clear on the special enrollment. Now, let's get into more details. You can apply for a health insurance plan via Covered California to get the most benefits, or you can purchase a qualifying health plan directly from any major medical insurance carriers in the state. If you need help with this process, feel free to reach out to us and we will help you. If you already have an account in the Covered California but have questions or need something fixed, we can help with that as well. You can easily delegate us as your insurance agent, and we will do all the hard work at no extra cost to you. I will have a link in the description of this video about how to delegate us so we can assist with your Covered California health insurance account. So once that is cleared out and you have applied for a health insurance plan, you just have to make sure that you keep the qualification with the app that you are working, so you get at least 15 hours of active time to receive the stipend. Keep in mind, app-based network companies do not have to pay stipends for insurance that is obtained through Medicare, medi-cal, or other employer-sponsored insurance, such as that obtained from another job. Minimum coverage plans purchased on the individual market do qualify for the Prop 22 stipend. However, federal or state financial help are only available to eligible consumers who purchase a plan through Covered California. So now, very important, you may wonder, when will I receive the big bucks, the stipend? If you qualify, you'll receive the stipend at the end of the quarter. For example, if you meet the eligibility criteria during the first calendar quarter, January, February, March, and you verify your coverage in early April, you'll receive your stipend later in April. That's it, very easy. In order to issue the stipend, the app-based company will verify your coverage before issuing you the money at the end of the quarter, right? Makes sense. You will need a Covered California account in order to download and submit a form verifying your coverage. This form will be made available through your Covered California account within about 15 days of quarter's end. Now here's my favorite juicy part. If you are an app-based driver, you may be eligible for advanced premium tax credits or state subsidy via Covered California, in addition to being eligible to receive the Prop 22 stipend. An app-based driver averaging at least 15 hours of engaged time per week for an entire year may be eligible for nearly $2,500 each year in stipends from their app-based network company to offset their paid premium cost. Drivers averaging 25 hours or more may be eligible for nearly $5,000 a year, in addition to whatever federal and or state financial help they may be eligible for to reduce their net monthly premiums. Okay, so let's take a look at an example. Let's say we have a app-based driver living in San Francisco. This person works at least 25 hours per week and makes $36,000 a year approximately. And this person is 30 years old. And let's say that this person wants to select a health plan, a silver plan, right? A PPO. Let's see how much that would be. So we are skipping the HMOs. Let's find the silver PPO. Here we go. So this person enrolls in a Blue Shield Silver PPO plan and pays $324.96 a month. At the end of the quarter, this person basically gets the reimbursement over $400, which covers more than he or she pays for the health insurance. So basically the insurance ends up being at no cost. So enrolling into a qualifying health insurance plan is very easy. Both new and existing drivers qualify for this qualifying life event, even if they already have a Covered California plan. A new driver who begins working for an app-based network company may use this qualifying life event, including drivers who may drive for a different app-based network company. New app-based driver enrollees using this qualifying life event will receive coverage effective the first of the month following plan selection. Remember, new app-based driver enrollees will need to pay their first month premium to effectuate their coverage, and they must pay the subsequent monthly premiums themselves. And also keep in mind that an existing driver may use this qualifying life event if they attest that at the end of the calendar quarter, they newly expect to qualify to receive the stipend. Also, it's important to note that the driver who already has a Covered California plan may use the qualifying life event to change their plan to a different metal tier or product. Now, for those who already have a health insurance plan and are using this special enrollment, please consider these important factors before changing your health insurance plan. The accruals toward your deductible may not transfer to the new plan. You will have to pay a new binder payment, select a new PCP because provider networks vary among plans, and set up a new auto-pay account. So consider that before changing your plan. If you have dependents and spouse enrolled in a family plan, you may use the stipend towards a family premium. This is a big deal. Just make sure that the driver is the primary on the account. This information may change, so stay connected for updates. If you found this video useful, please like, share, subscribe, and comment under the video. Feel free to follow us everywhere. If you have a specific question or need help finding a health insurance plan, feel free to reach out to us. We are a California licensed insurance agency, and we do not charge for our services. Again, this is kind of a big deal. Did I mention that we love helping people? Please spare 1 second of your time and like us. Thank you for watching this video, and again, don't forget to share, like, subscribe to our videos. Thank you.